Chapter 21 Gynecology. The female reproductive system. 1. Fallopian tube, salpins, ovary, neck of womb, cervix, vagina. Menstruation. A period is a common name for a menstrual monthly period. Menstrual period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctors' notes. LMP, LMP to over 52 ago means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the four 28, which means lasting for days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss. Menorrhea, often with the passage of blood. Coagulated blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In everyday English, is known as the change of life or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of heat, and night sweat. RT. A gynecological consultation. A gynecologist is talking to a 30 years old woman. Gynecologist. Are your periods regular? Yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12. When when was your last period? A week ago. How long do the periods last usually? Mm, 4 or 5 days. Would you say they are light or heavy? Light. Do you get clothes? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. What color is it? White. Part D. Contraception. For women, methods to prevent pregnancy include the oral contraceptive, pill known as the pill, the diaphragm, and the intrauterine device, IUD, or copper coil, or copper coil. Condoms are available for both men and women. Write a simply English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Number one, his hysterectomy, surgical removal of the womb. Number two, menorrhea, heavy periods. Number three, salpingitis, inflammation of one of the tubes that connects the ovary to the womb. Number four, cervical biopsy, biopsy of a small piece of tissue removed from the neck of the womb. Read read the conversation between the gynecologist and the patient see opposite and complete the notes about the patient. Manners. 12, 12, 12 years, 12 years. Menstrual circle. 4 to 5 over 28. LMP. 1 over 52 ago. Menorrhea. No. Menorrhea. No. Discharge. A little white discharge. Now write the question that the doctor asked. Ask. Look at the opposite to help you. Manners. How old were you when you started to get them your periods? Menstrual cycle. How are your periods regular? How long do the periods last you usually? LMP. When was your last periods? Nuria. Would you say they are light or heavy? Do you get clots? Menorrhea. Dysmenorrhea. Do you get periods pains? Discharge. Is there any discharge between the periods? What color iris? Complete the case report on words needed is needed twice. Look at B and C opposite to help you. Case 15. 45 45 years old man had been having prolonged periods lasting for day for 8 days with the passage of clouds for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had noticed any hot flashes or night sweat, and her general health had always been good. She has taken the oral contraceptive contraceptive pill until a year previously when a copper coil was fitted. She had had a normal pregnancy. When she was 25, she was when 25. Diaphragm, copper coil, condoms, and IUD. Over to you. What is the attitude to contraception in your country? Here is accepted. At what age do you think females should be prescribed contraceptive? At 18. Now, in Spanish. Ginecología. El sistema reproductor femenino. Útero. Trompa de falopio. Ovario. Cuello uterino. Cervix. Vagina. Menstruación. Un periodo es el nombre común para la menstruación mensual. El inicio de la menstruación se conoce como menarquía. El último periodo menstrual se abrevia comúnmente en las notas médicas FUM. Hace 2 entre 52. Significa que el último periodo menstrual fue hace 2 semanas. El ciclo mensual o duración y frecuencia de los periodos generalmente se describe en la forma 4/28, lo que significa que dura 4 días y ocurre cada 28 días. Si un periodo dura más de 4 o 5 días, se puede describir como prolongado. El término periodos abundantes significa pérdida excesiva de sangre, menorragia, a menudo con la expulsión de coágulos, sangre coagulada. El término dolores menstruales significa dismenorrea o menstruación dolorosa. El momento en que una mujer deja de menstruar, normalmente alrededor de los 50 años, se llama menopausia o climaterio. En inglés cotidiano se conoce como el cambio de vida o simplemente el cambio. Los síntomas de la menopausia incluyen sofoco, sensación repentina de calor y sudores nocturnos. Consulta ginecológica en California. Consulta ginecológica. Un ginecólogo está hablando con una mujer de 30 años. Ginecólogo. ¿Tiene la menstruación regularmente? Sí. ¿Con qué frecuencia la tiene? Cada 4 semanas. ¿Qué edad tenía cuando empezó a tenerla? Aproximadamente 12. ¿Cuándo fue su última menstruación? Hace una semana. ¿Cuánto suelen durar las menstruaciones? 4 o 5 días. Diría que son ligeras o abundantes. Ligero. ¿Tiene coágulos? No. ¿Tiene dolores menstruales? No realmente. ¿Hay algún flujo entre las menstruaciones? Un poco. ¿De qué color es? Blanco. Anticoncepción. Para las mujeres, los métodos para prevenir el embarazo incluyen la píldora anticonceptiva oral, conocida como la píldora, el diafragma y el dispositivo uterino DIU o espiral de cobre. Los condones están disponibles tanto para hombres como para mujeres. Thank you.